Good afternoon all. So today I'm here to discuss about innovation, the synthesis of a novel compound for use as a sealant in posterior capsular rents. So as we all know, incidence of posterior capsular rents is from 0.45% to 3.6% for experienced surgeons, and among residents it's a bit more, and approximately 10 million cataract surgeries are being performed here every year worldwide. Roughly this translates to around 4 to 5 lakh posterior capsular rents every year worldwide. So expert surgeons usually PCR is recognized quite early and appropriate measures are taken, whereas for trainees or residents, PCR and its subsequent potential complications such as aphakia can be a nightmare. So what we attempted to do is to achieve a workaround negating PCR as a complication of cataract surgery. So we wanted to develop a compound which can spread as a film and act as a glue to bridge the margins of a PCR or even an ALC tear. And we wanted to test the compound in animal eyes as well as in lab setup to see if it can achieve set objectives. So the compound that we chose to use is polyethylene glycol based hydrogel compound. PEG is known to be inert and transparent, and it is also biodegradable, and also it has already been used as part of drugs which are injected and as well as in adhesives which are being used in ocular purposes. So, and for synthesis, we used multiple trials were done with different PEG based hydrogel compounds, and one compound which showed promising results was lyophilized and tested in vials and in animal eyes. So this is just a graphical representation of what we intended to do. So here is the anterior lens capsule tear on which we intended to place a blob of the gel which would hopefully hold it together and prevent it from spreading further. And similarly, in a case of posterior capsular rent, we wanted to place a blob of the glue across the rent and hope that it holds repairs the integrity of the capsular bag and supports an IOL. So in the animal eye experiment, we totally excised the cornea to improve visualization, and the capsular excise was done in the usual method after trypan blue solution. Lens material was aspirated, and a tear was induced both in the ALC and posterior lens capsule. The gel was reconstituted and spread over the ALC and the posterior capsular end. So here we can see the region of the ALC tear and the region of the posterior capsular end both in the same eye. The ALC flaps were kept in apposition before the gel was applied. So here we were able to see the gel applied over the ALC and as well as the PCR tear. So the observation of our experiment was that the gel, although it formed a kind of a blob, it was unable to adhere properly to the biological membrane, and even after 10 minutes it was washed away by irrigation. Whereas in a lab setup, the gel formation was noted to occur within 1 minute and the gel adhered to the walls of the vial. So in this picture, we were able to see that even on inverting the vial, the gel was found to maintain integrity and held on to the vial, and it stuck onto the top of the vial and did not dissolve. And it was noted that the gel retained its properties at room temperature for 60 days. So the results as well as limitations is that it works well in vitro with desirable properties, whereas in the animal eyes, it does not work properly. So future directions, altering the concentration of various constituents used for gel formation will allow gel adherence in vivo. And this compound is protected by provisional patent applied to JIPMER. Thank you.
Thank you, Dr. Vignesh. Dr. Parikshit, sir.
Sorry, sir?
Have you done a proper prospective study for this on some cases, or it's just innovation?
No, sir. It is just in the lab and on the animal eyes, which we have obtained from an abatoir, sir. It is not. We have not yet
done.
No, sir.
Yeah.
But we intend to do it once it works.
So you will have to do it. But then the follow-up is also for a few hours in animal eyes,
yes,
not
sir.
more than a few hours.
Sorry, sir. In follow-up in the sense?
Once you put that gel,
yes,
and
sir,
you formed a membrane,
yes,
on which the lens was put.
Yes, sir.
So you followed it up for how long?
No, sir. So we waited for 10 minutes and we hoped that it would hold on to the remnant of the PCR or the ALC. And we tried irrigating it. The moment irrigation was done, it got washed away. So we are intending to go back to the lab and try out similar compositions so that it holds on to the membrane. So that is what we are trying to achieve.
If it is done in a cataract surgery, there will be irrigation all the time.
Yes,
later.
sir. Yes, sir. So that is the limitation.
Can I just give a small
question.
suggestion? Maybe you instead of trying to make the gel on the spot, you can make like a membrane from the same
yes, sir.
composite.
So
and you can put a whole membrane covering the
yes,
entire posterior capsule.
Like a film.
And then later it can get absorbed or
yes,
dissolved in the eye. That may be more feasible.
That is what we are planning in the next stage, sir. Thank you, sir.
Actually, it is an animal model or a cadaver model, because animal model means you should simulate a cataract surgery. You said you are removing the cataract and you are doing So it's not an animal model, it's a cadaver model.
Sir, it is a goat's eyeball.
Yeah, that is a cadaver, boss. It is not an animal model, it
Okay,
is a
sir.
cadaver model.
Okay,
Both are
sir.
different
Yes,
actually.
yes,
So
sir.
in animal model, you'll get a real-time simulation, right?
Okay,
You'll
sir.
be doing a cataract, you'll be making a PC rent, the vitreous will, here it is cadaver.
Cadaver,
eye.
yes,
So
sir.
both
Yes,
are
sir.
different.
Yes, sir. Okay,
You
sir.
don't have the dynamics in cadaver eye.
Yes, sir. Thank you, sir. So actually we made a very large rent so that which would preclude lens placement, sir. So that was our intention, but since it is not working out, so we are planning on further trials in the lab, sir. Sorry, sir. Vitreous disturbance. So yes, sir. In that case, then the eventual idea is that we'll have to do vitrectomy and then place the gel so that the lens can be placed in situ. No, sir. It is synthesized, sir. So one of our co-authors has synthesized it in the lab. Yes, sir. It is it is one of it's a compound synthesized from polyethylene glycol, sir. So polyethylene glycol is a known inert and transparent substance.
I think you are doing VR fellowship, right?
Yes, sir.
Then why are you doing all these things, boss?
Sir, actually, I did it during residency and
Now, what will you do for your food?
thank you, sir.